Hi everyone, this is Xiaochen Zhang from the Psychological Health and Imaging Group of Shanghai Mental Health Center, Shanghai Jiaotong University School of Medicine. I'm very glad to have a chance to present our recent work here, titled Disorder-Specific and Cross-Disorder Brain Morphological Abnormalities Across 4 Mental Disorders. I'd like to thank all the members of the PHI group, especially our principal investigator, Dr. Zhi Yang. Also, I'd like to thank all the co-authors and their research groups for their respective contributions to this work. First, let me give you a background of this research. Current psychiatric diagnoses are based on a categorical system. In contrast, few neuroanatomical alterations that are specific to each diagnostic category have been reported. Therefore, we'd like to fill in this gap and explore the disorder-specific neuroanatomical alterations for 4 major mental disorders. They are bipolar disorder, major depressive disorder, schizophrenia, and obsessive-compulsive disorder. We believe investigations into the disorder-specific alterations likely lead us to a better understanding of disorder-specific etiological processes, and thus to possible specific treatments for different psychiatric disorders. A probable explanation for previous difficulties in searching for disorder-specific neuroanatomical abnormalities is the lack of simultaneous comparisons between multiple diagnostic groups with a constant clinically normal control group. So in this study, we used a single-site multi-diagnosis dataset and directly compared the brain morphological measurements across the 4 diagnostic groups with the same group of clinically normal controls. In addition, investigations into disorder-specific brain alterations call for a framework where the discovered disorder-specific brain alterations could be compatible and not confused with previously discovered transdiagnostic ones. Therefore, we attempted to establish a framework for the operational definitions of the disorder-specific and the transdiagnostic abnormalities to be both compatible and conceptually exclusive to each other. We define the disorder-specific brain alterations as those aberrant from the clinical norm for only one diagnostic group. Particularly, we emphasize that for the other diagnostic groups, such aberrance from the clinical norm should be absent. For instance, this measurement X presented here represents the brain abnormalities specific to disorder C. We define the transdiagnostic brain alterations as those aberrant from the clinical norm for 2 or more diagnostic groups. We further distinguish disorder general alterations from spectrally transdiagnostic ones. The disorder general alterations are defined as the transdiagnostic ones where the multiple groups that show such alterations are similar to each other. For example, this measurement Y presented here represents disorder general brain abnormalities shared between disorder C and disorder D. The spectrally transdiagnostic alterations are defined as the transdiagnostic ones where at least 2 of the multiple diagnostic groups that show such alterations are not similar to each other, but significantly different from each other. For example, this measurement Z presented here represents brain abnormalities that qualitatively shared between disorder C and disorder D, but to significantly different extents. So they may actually be on a transdiagnostic spectrum of certain brain deficits. Based on this framework and on 1,366 cases from a single-site brain imaging database, we extracted 306 regional features, including cortical surface area, folding, thickness, and roughness at 68 cortical regions, and the volume of 34 subcortical structures, according to the Descon Cleany and ESSEC atlas for each subject, with free surfer based on their T1 images. For each feature, the raw values of the direct measurements were transformed into an abnormality value after the age, sex, and total intracranial volume being regressed out via normative modeling and then were normalized according to the distributions of clinically normal controls. For each subject, the vectorized features formed a profile of brain morphological abnormalities. We first highlighted the direct brain measurements representing disorder-specific and transdiagnostic alterations. Indeed, we found a lot of transdiagnostic alterations in brain morphology in line with previous literature. However, we found disorder-specific alterations only for the schizophrenia group and the OCD group, not for all the 4 groups considered here. We found that the patients with schizophrenia specifically had smaller bilateral hippocampus than clinically normal controls, and that the patients with OCD specifically had reduced cortical folding at 3 cortical regions. Then, we decided to take a different perspective to look into the data. Considering the high covariances between the direct brain measurements, we further explored the dimensionality of the latent factors underlying the brain morphological alterations across the 4 major mental disorders. We applied an exploratory factor analysis on the individual regional estimates of morphological alterations, and we turned out to reveal a high dimensional latent factor space. We then identified its dimensions representing disorder-specific and transdiagnostic latent factors that affected brain morphological alterations. This time, we managed to find disorder-specific latent factors affecting brain morphological alterations for each of the 4 diagnostic groups considered here, as well as many transdiagnostic latent factors, which is not surprising. Notably, for bipolar disorder, major depressive disorder, and schizophrenia groups, there is only 1 disorder-specific latent factor for each group, suggesting that all the disorder-specific data covariances across various brain morphological measurements were in a highly similar pattern and thus were organized into a single latent factor that possibly represents a disorder-specific aspect of the underlying etiological processes. In addition, we observed that the individual abnormality profiles in the direct measurement space were mutually more resembling across participants only within the bipolar and the schizophrenia groups, not within all the 4 groups. However, after the space transform, the individual abnormality profiles in the latent factor space were mutually more resembling across participants within all the 4 diagnostic groups considered here. These results support the rationality of the current category-based diagnostic labeling from a neuroanatomical perspective. Interestingly, we found significant topographic correlations between the serotonin receptor density across the brain and the loadings of a particular type of brain morphological measurements to the first 3 factors, suggesting neurochemical associations of some dimensions of the latent factor space underlying the brain morphological abnormalities. In conclusion, in this study, we attempted to clarify the operational definition of disorder-specific brain alterations. And based on a single-site, multi-diagnosis dataset, we discovered disorder-specific latent factors affecting brain morphological abnormalities for all the 4 major mental disorders under consideration in this study, and disentangled them from transdiagnostic latent factors. We hope the current study may provide novel insights into the neurobiological substrate underlying major psychiatric disorders, as well as into the categorical-versus-dimensional debate on the intrinsic relationships between various psychiatric disorders. At last, I'd like to thank all the audience. Thank you very much for your listening. Your comments on this work are really welcome. If you have any comments, please feel free to send them by email to the correspondence order. Thank you very much.